Headache is pain due to irritation of intra or extracranial structure such as meninges or blood vessel. The headache is divided into two types, primary headache and secondary headache. The primary headache include tension type, migraine and cluster headache, while the secondary headache mean headache which produce as a consequence of other head and neck or brain pathology such as subarachnoid hemorrhage, meningitis, hydrocephalus, neoplasia, or the giant cell arthritis. In this video, we will study about primary headache. So let's discuss the three types of primary headache one by one. The first one is tension type. The tension type headache is the most common primary headache. It is more common in female as compared to male. Clinically, the patient will present with bilateral headache, such as there will be dull band-like pressure over the forehead, and there will be no associated symptoms such as nausea, vomiting, or aura. Sometimes the patient can present with photophobia or phonophobia, but only one of these two will be present. The both will not be present at the same time. To treat the tension headache, we divide the treatment into two types. Acute mean when a patient present with tension headache, how to treat, and second one the prophylaxis. To treat the tension type headache acutely, we use two drugs, NSAID and acetaminophen. And to treat the tension type prophylactically, we use TCAs, the tricyclic antidepressant such as amitriptyline, and the second option is behavior therapy. The second type of primary headache is migraine. The migraine is a unilateral headache, and the patient will present with pulsating unilateral pain for about 4 to 72 hours, and it will be associated with nausea, vomiting, photo or phonophobia, and aura. The photophobia mean the fear of light, and the phonophobia mean the fear of noises. The cause of migraine is not known, but there are some speculation that migraine can be produced due to the irritation of trigeminal nerve, cranial nerve 5, or increased secretion or the synthesis of a neuropeptide CGRP, calcitonin gene related peptide. This neuropeptide causes vasodilation, which is suspected to be the prime pathology in migraine. To treat the migraine, we divide the treatment of migraine into two types, acute treatment and prophylaxis. The acute mean when a patient present with a migraine. So at acutely, we can use NSAID, triptan, dihydroergotamine, and for symptomatic relief of nausea and vomiting, we can use antiemetic. For prophylaxis, mean to prevent another episode of a migraine, we can advise a lifestyle changes such as sleep, exercise, diet. Along with this, we can advise a patient beta blocker, topiramate, valproate, and amitriptyline. So all of these drugs can be used prophylactically to prevent another episode of migraine. Now come toward the third and last type of primary headache, the cluster headache. The cluster headache is more common in male. The patient will present with unilateral periorbital severe excruciating pain for about 13 min to 3 hours, and it will be a recurrent pain, and this pain will be associated with autonomic symptoms such as lacrimation, rhinorrhea, conjunctival injection, or sometimes Horner syndrome. To treat the cluster headache, we again divide the treatment into two types, acute treatment and prophylaxis. For acute treatment, the first line management is 100% oxygen, hyperbaric oxygen, and the second option is sumatriptan. And for prophylactically, mean to prevent the next episode of a cluster headache, we can use a verapamil, which is a calcium channel blocker. So it was all about the primary headache. Let's summarize these three types of primary headache. The first one is the tension type. The tension type is a bilateral headache, more common in female, and it is not associated with nausea, vomiting, photo or phonophobia. The second one is a migraine. The migraine is a unilateral headache present with the clinical feature of pulsatile pain with associated with nausea, vomiting, photo and phonophobia. The third one is the cluster headache. The cluster headache is a unilateral periorbital headache having excruciating pain, more common in male, and is associated with autonomic symptoms such as lacrimation, rhinorrhea, or conjunctival infection, sometimes Horner syndrome. was all about the headache. If there is still any question, you guys can ask and stay tuned for more update.